So hello everyone, my name is Stacy Terrell. I serve as a Diversity and Inclusion Manager for USAID's Global Health Technical Professionals Program. For the duration of the webinar today, we're going to make sure that if you're not in a speaking role, that you stay muted. We were thankful enough to receive a lot of questions from the participants ahead of time. So we're going to try and get to as many of those questions as possible. But just bear with us with the technology. Just make sure that you're muted so that we can make sure that we can hear our panelists. Great. So I just want to make sure everyone can see the PowerPoint slide. We're going to start by just greeting everyone here. We really appreciate everybody participating today. And we will kick things off. So first, just want to give a little disclaimer that these materials that have been produced are authored by Global Health Technical Professionals, which is supported by the U.S. Agency for International Development. So the contents here do not necessarily reflect the views of USAID or the U.S. government. And just want to briefly go over our agenda for today. I'll be introducing all of our panelists. Then we will go right into questions. They'll share a little bit about their experience. If we have time, we're going to try and see if we can take some audience questions by chat. I see some of you have already kicked that off, so thank you for that. And then we'll close. So again, I will be moderating the questions today, but our focus is definitely going to be on our panelists, and we're thankful that they participated today. We did have a previous webinar, the webinar last month, that was more just the basics of what is GHTP and what are the specifics of the applications. And I know some of you have asked some questions about the application. So we're just going to give a brief overview about all of the mechanisms because our panelists are representing multiple global health hiring mechanisms today, and then we'll kick off the questions. So briefly, just wanted to go over what USAID is. It's the U.S. Agency for International Development. It operates in over 100 countries, and it leads the international development and humanitarian efforts to save lives, reduce poverty, and strengthen democratic governance, and to help people progress beyond assistance. So, in terms of the global health hiring mechanisms that are represented today, we wanted to highlight three. So one of the things that GHTP, or Global Health Technical Professionals, is tasked with is sort of being the overarching mechanism that's really charged with expanding the diverse reach of the Global Health Bureau. So as part of that, when we go out to different conferences or we go out to universities, we want to make sure that we're highlighting all of the global health hiring mechanisms. So we just wanted to give a brief overview of all three. And the women who are speaking today represent all of these mechanisms. So for GHTP, and this is just the highlights, it's really focused on recruiting early to mid-career global health professionals that we call technical professionals. And those TPs participate in mentorship program, and they also receive an annual professional development fund. So we know that since they're in the early to mid-career phase, that we want to make sure that they have opportunities to continue to pursue certificates and continued training to make sure that they can continue to advance up the global health ladder. Then we have Global Health Support Initiative, or GHSI-III, and that mechanism is focused on recruiting mid-level to senior global health professionals. It also is a great opportunity to kind of get your foot in the door too, because they also recruit entry-level program assistant and program analyst roles. Some of those are serving in administrative roles, some are focused on budget. So it's a great opportunity to kind of get into the Global Health Bureau that way. And then last, we have Sustaining Technical and Analytical Resources, or STAR. And this program recruits senior level global health fellows with a strong focus on learning. So everybody has a learning component to their role. And then they also recruit paid interns at the graduate level. So current students or recent graduates within the last year or so are eligible for those paid internship opportunities. And all of these positions and any of these mechanisms, as a baseline requirement, the majority require you to be a U.S. permanent resident or a U.S. citizen, and that's strictly because of it is working within a government agency, and you're likely required to have a clearance of some sort to be able to work in those spaces. So that's just a really brief overview. I'll be sharing materials that are more in depth about these programs to everybody who's participating today, but just wanted to give kind of a big picture where all our panelists are coming from, and they can provide more information about their specific experience within their mechanism. So wanted to introduce our panelists. Today we have Dr. Lindy Fenlison. She's a Senior Nutrition and Capacity Building Advisor in the Office of Maternal and Child Health. Then we have Tara Ornstein, who's a Multilateral Advisor in the Office of HIV/AIDS. And then we have Uchechi Roxo, who's the HIV/AIDS Regional Advisor, also in the Office of HIV/AIDS. And to get things started, the first question we have, and this is going to be sort of a bio question to kind of fill out more of just their name and their title and their office. We'll start, I believe, with Lindy. How did you enter in the field of global health? Sorry, I think you're, okay, now we hear you.
Can you hear me? Okay, great. So how did I enter the field of global health? I was thinking about this earlier. It started with some interest when I was really little. I wanted to work with other cultures, other populations, because I had some relatives that were doing that. They were living in other countries, working with other cultures. And so I went to my mom and I said, that's what I want to do. And she said, well, great. What are you going to do for those people? And I said, I don't know. I'm just going to go. And she said, well, maybe you should have a skill set to offer. And so the interest that brought me to global health then led to identifying some kind of a skill and then applying that skill. And I was reflecting on this because I think that my whole career in global health has followed that same trend. So I identified the fact that I wanted to work with other cultures. And then the skill I found was going into medicine, because that seemed to be something that would be useful to other people. So then I went ahead and got some skills as a medical doctor. And even before then, as a certified nursing assistant, I went for 2 weeks to the Dominican Republic, and then kept on my progress to do pre-med and then med. And then with every step of experience that I've had, it's been following an interest and figuring out what skill gap I have, and then addressing that skill gap, getting some kind of a skill, and then putting that into practice, doing some kind of application with my next job step. So that's kind of how I got into it. I think my biggest entry into global health, I guess my biggest step, was after I finished my pediatric training, was that I joined Baylor International Pediatric AIDS Initiative, and I went over to Lesotho, a tiny country in sub-Saharan Africa, and I was there for a few years, focusing mainly on HIV and AIDS. And then I realized that nutrition was an interest of mine that was really rising to the front, and that was a big need in the country. And so from there, my career kind of started taking a different direction and looking more at nutrition and the intersections of nutrition and health. Anything else?
That's great. We'll go next to Tara.
Hi, everyone. I hope you can hear me well.
Yep.
So I got my start in global health after I finished my undergraduate degree, when I had the opportunity to participate in a fellowship sponsored by the U.S. Department of State. It was called the Young Leaders for Public Service Fellowship. And through that program, I had the opportunity to spend 12 months working on HIV prevention in northern Russia. And it really stimulated an interest, a career interest in mine. It was something that I could use in my work back in the United States. So after I returned to the US, I continued to work for global health organizations. And since then, I've worked in a number of countries, with most of my work focusing on HIV/AIDS and tuberculosis.
Awesome. Last but not least, we'll have, if you prefer to go by Chi-Chi, it's up to you, whichever you want me to call you.
Yeah, Chi-Chi's fine. So for me, I'm from a second generation Nigerian family, mom and dad. So, and my mom is a midwife. My three of my five sisters are in the healthcare profession. So just between summers in Nigeria, visiting cousins, and then really formally starting to work in global health. For me, I did a fellowship. It was a 12-month fellowship right after undergrad that Brown University sponsors called the Thomas J. Watson Fellowship. So you can research any topic under the sun. I chose to look at go to South Africa and looking at monuments, museums, and memorials. I started to volunteer, and like any other place in the world, you can't run from public health issues. So that's kind of my entree into the field.
Thank you. So next up, just want to, we'll go in the same order for this next question. What is a typical day like for you in your role?
So a typical day for me, I guess yesterday was pretty typical. I started off the morning answering a lot of emails in front of my computer and reviewing some documents with some team members. Then I jumped on a call where we were talking with, my nutrition team was talking with some partners that we have hired from GHSI and some other organizations, Helen Keller International, to be able to implement some nutrition programming that we're going to be doing for the next 5 years. And it's really exciting work that we're doing. We're pulling in all the nutrition folks at USAID, and we're working with this incredible partner, and we're figuring out how can we do some nutrition work that's focused on the nutrition priorities that we're dealing with around the world. So I was on a meeting just kind of dealing with the nitty-gritty of some of the activities that we're designing. Then I got in my car and drove to the University of Minnesota because I'm based in Minnesota right now, still working for USAID, but I telework. So I ran to the University of Minnesota and met with their global health team, their Center for Global Health, where we are working on doing some more partnering with USAID and figuring out how we can do mutual capacity building between academia and USAID and really leverage the resources that we have in both organizations. So I met with them and then hopped on the phone again with my team back in DC to have our weekly meeting where we were talking about, you know, how things are going with our internal USAID nutrition team, and what are some ways that we can be integrating more into health, and just talking about, again, some of the specific activities that we're working on, World Breastfeeding Week and things like that were coming up. And that was kind of how it looked. So it was a mix of computer, in-person FaceTime, kind of big picture stuff and smaller detail things. So for me, the variety is good, and that's probably a pretty good example of a typical day.
Thanks.
For me, my work at USAID can range from managing technical assistance projects that aim to ensure our partners have the support they need to achieve epidemic control of HIV, to working with our partners at other US government agencies and multilateral organizations, particularly UNAIDS and the Global Fund, to respond to challenges encountered in the field. Recently, I had the opportunity to travel to Tajikistan, where USAID helped convene a seminar on the long-term sustainability of HIV programs. I felt that my previous experience in Central Asia and my language skills helped me to understand the regional context really well and establish a solid working relationship with our partners.
Yeah, and maybe just a few additions. I think at least in every office kind of has its own culture, but in the Office of HIV and AIDS, and there are probably similarities, a lot of a typical day is meetings, reaching consensus around issues, trying to prioritize who will develop and clear critical documents. I work a lot, as my colleagues just mentioned, with the team in headquarters as well as our field teams. So early calls was mentioned. I live in Google Docs. Much of what we do is collaborative. And, you know, depending on the day, one really has to sit down and not get caught into emails and meetings, because by the end of the day, you actually have to do additional work. So a typical day for me, in addition to what everyone said, is really trying to also write and do things that are impactful. working on procurements. Friday, for example, my typical day and week will be sitting at a mission to cover folks that are away on leave. So a lot of variation, exciting things, and also the mundane, checking emails and making sure your response time is quick. Thank you.
Thank you. That's super helpful. One of the things that we asked all of the participants today was, about their own personal perceived or real barriers to starting a career in global health. Can you tell us about an unexpected challenge that you've faced in your career? And we'll start with you, Chi-Chi, on this one.
Yeah, so I'll do one that I'm facing as a mid-level professional, and then maybe a quick one as a young professional. Mid-level for me is a real tension about whether I want to continue to generalize, so work across different areas within my current scope. You see my title is Regional Advisor, so I cover in any given year of assignments, 6 or 7 different countries and now a region. So there's a tension for me right now between working across different areas and then how to specialize, whatever that saying is, jack of all trades, master of nothing, that's where I'm at right now. So finding rewarding aspects of your work is easy, but being stretched and wanting to know and be steeped in a really specific area within this field for me is something I'm grappling with right now. Earlier in my career, it was entry. I did not have a strong network because I decided to go abroad. So I had to do a lot of volunteering. Most of my first jobs were created out of actually free labor. So we can talk more about that. I'll stop on those two.
Any that come to mind for you, Lindy?
No, it's been completely smooth sailing. No bumps at all. No, absolutely. Like, my gosh, one challenge. I think there have been a lot of them, and they've resulted in cool things, but it's been hard going through it. I think there have been more pauses and gaps than I thought that there would be. It wasn't as direct of a route as I guess it maybe naively had anticipated, but I think, I don't know that naive is really the word I would use for it. I think it's just, we kind of have hope and expectations, and things move more slowly than we would like them to. So there were times, in my career where I stayed in a certain job longer than maybe I wanted to, while I was waiting for the next one to come about. Times when I was even, in between jobs, when I was just trying to really be true to what my skills and my priorities were, and what the options were available at the time. And that's hard stuff. It's hard to navigate that. And I absolutely resonate too with what Chi-Chi was saying with finding that focus. And in fact, when I was back at Vanderbilt doing as a faculty member after coming back from Lesotho, and I was there for a few years, and I actually developed this little model that I use for myself and for for trainees and things. Is I call it my Zen diagram. And it's basically a Venn diagram where we pick like 3 or 4 areas where in our career, how do we want to contribute? At the end of the day, at the end of our life, how do we want to contribute? What are the areas that we're most passionate about, and we really want to make our mark? And so, you find those 3 circles, and you want your work to fall into those 3 circles. And whenever possible, in those overlaps of those circles, and whenever ever possible, in that sweet spot in the middle where they all intersect. And so for me, I'm there, right now in this current stage where I've got global health, I've got capacity building, mentorship, advising, and then I also have my family and my close friends, which is also a very important part, I think, of living a fulfilling life. And I'm at the University of Minnesota. I'm working for USAID. We're doing capacity building initiatives focused on global health. And I'm based here in Minneapolis, closer to family. So I'm filling those circles. But in every stage of my life, I kind of come back to that diagram, and I think about, is this still a good fit? Is there something that needs to be tweaked? So there are definitely lots of unexpected challenges. And then I think we have to kind of go back, reflect on what's going on, what's not sitting right. And then either reach out to other people for support, or kind of do some more of that reflection ourselves and come up with something that can help guide us along the way. Most likely a mix of the two. It's coming from what's inside and then also reaching out to get that support along the way.
That's incredibly helpful. Thank you. When we asked that question, the number one response that we got about barriers was that participants feel that they don't have enough experience. So what advice would you give to recent graduates or career changers who feel that they have less experience in the field?
Do you want this back to me, or do you want one of the other participants?
We'll start with you.
Sure. I think that's definitely a hard one. It's like that, the catch-22, right? So for me, I guess the best advice that I would give is to take stock, kind of in two different ways. So one, take stock of the current skills and experience that you have. Are there some experiences that you've had that can actually translate really well as intercultural experiences, even if it's not field work in some other international country? Are you working with other cultures within the US? Cultures being very, very broadly defined. So kind of taking stock of your experiences, thinking about, is there something that I'm missing that's actually very transferable? And then secondly, taking stock of the options that are out there. Are there, we all have our preferences of where we want to be located, what kind of international experience we'd like to be getting. Do we want it to be a few weeks at a time? Do we want to be somewhere for a few months? Do we want to be somewhere for just pick up everything and move abroad? And there might be some options that we've ruled out because it doesn't match what our preferences are. So I say take stock again of those options and see if you might be able to expand your preferences to open up some other opportunities that would get you some of that experience that you're looking for.
Thanks. We'll go to Tara next.
Sure. I think it would be helpful to think about the skills that you've acquired through university studies or in other fields, and how they can transfer to global health. One example that comes to mind is data analysis. And that's something that most people have experience with either in grad school or as an undergrad. And it's a skill that is really useful to your career in global health. So being able to talk about how you would approach data analysis or your experience in data analysis, even if it's not health focused, it would be helpful in an interview because it'll show you that you have that skill and you do have transferable experience or experience that's relevant for a career in global health. Another thing that comes up a lot is, as Lindy said, foreign language and international experience. And one more thing I might point out is the ability to write well. So a lot of us have acquired skills in academia or in other fields, particularly in writing concisely, that would be really helpful to global health in general and particularly to USAID.
Yeah, and maybe two additions because Lindy and Tara got very concrete, so I want to build on that. Age is not, a factor or a barrier. You can get experience. I mentioned volunteering, the domestic side of public health, community mobilization, skills that we see are critical parts of programs. Some people work in, say, family businesses, things like property management, where there's a financial management component. As you break down your skills, think about your brand, right? So there's the packaging in your resume, as the other distinguished panelists talked about. And there's also like the time that you are looking for a job, what are you doing to position yourself in a way that is a huge differentiator? Even working at USAID, going on the 10th year with a 2-year gap, what am I always thinking about? What's the next conference? How can I do an abstract? How can I publish? These same areas that professionals are doing, you can do as an early career or transition person. So, investing in yourself and acquiring a few things that you enjoy in these skills is probably the best way forward if you can do that.
Thank you all. One other question that panelists asked was about mentorship. How have you all been able to find mentors and or networking opportunities? And we'll start back with you, Chi-Chi, on this one.
Sure. I actively seek out mentors, and I have, just because it's my nature. I'm an extrovert, one of 5 kids, middle kids, some older, some younger. It's just kind of my go-to. So I've been very intentional about it. Some have not worked out well, right? Because mentoring is a two-way street, and you have to also be offering something, right? Each person's time is valuable. So I think as you look and do that exercise that I love, that Venn diagram exercise that Lindy talked about, being intentional with, beyond social media and things like LinkedIn, going to people who are doing good work, people who you want to emulate certain, traits after. I know it's not easy if you're looking for work, but everyone has a network. And then obviously when you start working, if there are opportunities that are actual informal mentoring programs, or you want to start up one, peer-to-peer mentors, those are a few suggestions from my end.
Great. I know you have a lot of experience around mentorship, Lindy. Any tips for finding and seeking out mentorship opportunities?
I think Chi-Chi mentioned a bunch of incredible ones right there. I guess to kind of go back to one of the things she was mentioning, even when you're looking for work, finding conferences that you can go to. Again, sometimes it's hard. You're trying to make ends meet, so you don't have a lot of money to be flying all around the country or all around the world to be doing these things. But finding a conference or two that is feasible financially and time-wise to go and to be a part of, and spend time trying to be extroverted, even if you're not, even just for that time period, and introducing yourself to other people, stopping by posters, asking others that you know in the field to introduce you to other people that are doing the kind of work that you would like to do. I think that can be helpful. And then those conversations, even though sometimes they're just very simple conversations to start, they can turn into mentoring, or they can lead you to a mentor down the road. So I think there's so much potential, whether you're looking for a job and trying to attend events with people that are doing the things you want to do, or when you actually get in that job, to then look around the tables that you're at and figure out who is it that I want to spend time with, even if it's just asking if they would have coffee with you and starting with the conversation. It doesn't have to be a mentorship agreement with their signatures on some black and white piece of paper, but just starting off with a cup of coffee, and then those kinds of relationships can evolve. And you can definitely reach out to somebody who you know for sure is doing the kind of work you want to do and ask them if they would formally mentor you. But it can start as simply as a conversation or a cup of coffee.
Thank you, guys. So just thinking back to, your undergraduate or your graduate experience, what's one thing that you wish you knew about working in global health? And then we'll start with Tara for this one.
Sure. So one of the things that, looking back, I remember my background is in infectious diseases. And I remember studying the challenges in detail. But now, global health is a really exciting place to work. The rapidly evolving technology has really changed global health in a positive way. So in addition to having technology that will help save costs, we also have new medicines and new diagnostic tools that are available in both HIV and TB, and I'm sure in other fields.
Thanks. So we'll go to Chi-Chi next for this one.
Honestly, the stuff that comes to mind is more a little bit of contentious. For me, like any field, I think there are people that are in it for different reasons. And some of them for the right reasons, and some, I think, a complicated combination of events that led them to this field. Like any field in international development, you have responsibility to be ethical, to safeguard certain aspects of what the U.S. government, embodies and what you should be doing, and just be a good global citizen. In this field, you cannot see that every day. In some countries and in others, you see some of the best people. So in my younger years, I wish I was a little bit more prepared for the vast majority of people you come in contact with, from host government, stakeholders. I've really had to learn diplomacy skills, even when you see the wrong thing, how to conduct yourself in a way that does not always place you to vocalize a concern or an injustice. I hope that makes sense. I think there's a lot of cultural competencies is where I'm going with this. And there's a high level of maturity as you get more responsibilities in this field. All skills everyone can acquire with experience, but I wish I knew more that, like, even though you're in a field to help people, there's an underbelly, if you will, to it as well.
That is super helpful. Thank you for sharing that. Lindy, do you have any thoughts on what you wish you knew?
Yeah, I think for me, what comes to mind is I wish I would have known more how I wish I would have known that there were a lot of options for being involved in global health, and know more about what those individual options were. So for example, when I started off with interest in global health, the way that it was kind of done then was that, especially if you went into medicine, you go to another country maybe twice a year, you start investing in that community, you'd provide some services, you'd build a relationship. But there's so much more to global health, as we all know, right? I mean, that's just like one little small way that things used to be done. And thank goodness that's not the main way that we're doing those things primarily now. Like, there's so many other ways to provide impact. And I think as I'd gone through my career, I wish I would have better understood how academia is involved in global health, how NGOs are involved in global health, how funding agencies are involved in global health, and the characteristics of those organizations, and the skill sets that they can that they really utilize. Maybe my trajectory would have been different. Maybe I would have bypassed medicine and gone straight into more kind of like general public health. Probably not. And I'm very happy with my trajectory. It hasn't been a direct point A to point B, but no one's is. And I wish I would have known that too, because it's easy to beat yourself up if you think it's supposed to be directly from point A to point B. But I still wish I would have known kind of the characteristics of the players, so I could have seen better the landscape and then also how I fit into that.
Okay, that's super helpful.
Can I make an addition? I think, because that resonated for me, there's so much that's different in the training and the curriculum now than I'm mid-40s than I think when I chose to pursue my degree. So I do think, at least for me, those tools and trainings are evolving, like Tara said. So maybe they're more widely accessible, at least some of the stuff I talked about. But Lindy, I hear you. I feel like programs have come a long way. Public health, MSCs, Master of Science, dual degrees. So you all are in a good place. A lot of folks, recent grads, are in a better place than some of us were.
That's very helpful. So we're going to try and take a few questions. We have one actually that just popped up that I think we're going to see if Tara can take, which is, someone stated they found that their age was a detriment. They had an 8-year career in domestic public health with immigrant communities in New York City. After grad school in their mid-30s, they were and entered through a previous program, GHTP, and then as a consultant. Do you want to take a stab at that one, Tara?
Sure. So what I can say is that people join USAID at all life stages. I'm sorry to hear that this individual feels that their age has been a detriment. But I would urge you to keep applying. In my case, as Lindsay said, I didn't have a point, a straight trajectory. And in fact, it took a couple of rounds to find the right fit. So it's important not to get discouraged and keep trying. Even if it doesn't work, one opportunity doesn't work out, or you feel that you're not getting any hits, definitely keep at it. Another thing that I would like to kind of explain is that the hiring process can take a while. So if you're used to the private sector hiring process, that might be a little faster than what typically happens at USAID, just because teams work together, they're collaboratively interviewing candidates, and there are a lot of levels to go through on our side. So the hiring process tends to be a little longer than it is in the private sector.
So we have one about what skills do you think are most useful in the global health field, and what programs in terms of software do you think are becoming more widely used? Whoever wants to take a step, or we'll go there.
I'll start off with something, but I'm sure these other panelists have a lot to say. Chi, I can see her; she's like ready to jump. So I mean, some skills there. I think it's interesting. So I was talking about this with some other folks around nutrition capacity building around the world, and whether we've got technical skills and then we have functional skills. So in terms of what skills are most useful in the global health field, technical skills definitely, especially if you've got an area of passion, some certain health topic or whatnot. But also functional skills. So all those things that we call soft skills, which I hate that terminology because they're not soft. Those are hard skills, but they're so important. So the teamwork, the interpersonal skills, communication, all those things, man, if you don't have those, that's wonderful if you have technical skills, but if you don't have the functional skills, then global health is going to be really, I think, hard for you to get into or to stay in. So I cannot emphasize enough those kind of functional skills. In terms of programs and software, I'm probably not the best person to talk about that. Like, man, I see Tableau everywhere these days in terms of being able to visualize our analytics. But maybe these other guys could contribute with their insights as well.
Applause, because the software question, I'm like the least software person in terms of like being able to spit out what I have seen in terms of skills. And we live in Tableau, at least in the PEPFAR HIV world, the President's Emergency Plan for HIV and AIDS. There is a real push related to reviewing data to look at geospatial analysis and tools. So that kind of niche training area is another. When we're looking at programs that are focusing on specific populations, there has been an interest of lately for folks who have either done research or spent, whatever period working with either indigent, mobile populations, conflict, post-conflict settings. So that bit of what I mentioned earlier, little things that can differentiate you, homeless populations, there's a lot of transferable skills in terms of programming and knowledge. The software question, we can easily get back to Stacy on that, because nothing comes to mind besides Tableau, because we also have whole teams of people that do health informatics and systems folks.
Yeah, I agree. I think that the functional skills that Lindsay mentioned are really important. You can be a talented epidemiologist, but if you don't work well with others, then it's going to be hard to find a job in global health. So having the ability to work with different types of personalities, with colleagues that are globally dispersed, and being flexible. In terms of the software, again, technology changes pretty quickly. So as long as you're able to develop a skill and learn new things, then that'll work out well for you.
So we had one other question about Peace Corps, return Peace Corps volunteer experience. I don't know if any of you have any specific feedback about your experience working with Peace Corps volunteer. I know there are plenty. There's a whole employee resource group that's returned Peace Corps volunteers at USAID. So don't know if anyone wanted to chime in on that one. If there are advantages or challenges to entering into global health with Peace Corps experience.
I can say that there are a lot of returned Peace Corps volunteers. My supervisor, for example, was a Peace Corps volunteer in Central America. It is a great experience for sure, and it shows that you're aware of the challenges that are faced in the field.
Great. We got one question about if you consider applications from people that do not have a master's degree but have 15 years of work experience, including in global health. And this person has said, they haven't been able to, make it to the interview rounds for positions. I'll say specifically with GHTP for sure. A master's degree is definitely, it's great, and that coupled with experience is great. But when you look at our specific job descriptions, it doesn't say that a master's degree is a requirement. Bachelor's degree is a requirement, but if you don't have a master's degree, then you just need to have more years of work experience. And having 15, that for most of our positions that we put out, that puts you at least, in the running for these positions. And I think it's other positions and other mechanisms for fellowship programs generally, the master's degree is a requirement, but for sure for GHTP, that's not a requirement.
I think it can actually be a barrier if you don't have it, but again, it depends on the position. It depends on your network. I mean, we recently hired someone at a mid-level position that I could have sworn we put required in the position description, and she got the job. I think it was an issue of she had so much rich experience that you couldn't ignore. And I believe she had started her master's, and it was just an issue if she hadn't finished. Yeah, I saw it as a barrier earlier in my career to move from a administrative assistant and coordinator and program assistant. I had an HR person tell me very bluntly, you cannot move unless you go do this. But again, everybody's situation is different. So I want to go back to Lindy's point. You find the right organization, experience trumps education. So I think it's also looking at a search that's broad enough as well, where that can be fully appreciated.
So someone asked a question about GHTP positions, and yes, our website has not yet, it's been a whole journey to get our website approved by USAID, but in the link that will actually appear in this PowerPoint, and we'll send a PDF of this presentation, you'll be able to see all of our open positions. So they're posted on our company website at the moment, so we will make sure you get those. And then somebody, I think, maybe came in a little bit late, just wanted to, if we have any additional tips that were previously shared or haven't been shared about ways to gain global health experience as a recent graduate from a master's degree program.
Lindy or Tara, you want to start, or should I?
Why don't you go ahead and start?
So, I mean, I think you joined a little late. A few things that maybe are different are, I don't even know what's different. The big ones for me in my career were volunteering, taking internships where I was paid less, and then you have to catch up again with salary history. That's not the best avenue for everyone. Looking at domestic opportunities. We talked about transferable skills and what you enjoy, really focusing on what you enjoy. Some people also go the consulting route. I know many, I got to use the M word, millennials that are, developing websites, literally creating business for themselves through a LinkedIn network or network of university opportunities that started, that turned into money makers. All of these with an eye toward getting more experience to enter. And then Tara said, apply, apply, apply. Everything you see, the ball drops at some point.
And I can just piggyback on that. That's awesome. Thank you so much, Chi-Chi. There are a couple things that you said that just kind of spurred something up, and now they're starting to float away from my brain. So let's see if I can pull them back. The idea of like apply. It's like some of the experience that you're getting is, of course, the experience international, but also the experience of figuring out what's going to be a good fit for you. So, one exercise that you can do as you're looking through, job postings even, is look through and find out, take a highlighter, or like pull up the PDF and highlight, or circle or whatever kind of marking you want to do on your computer, and figure out like what is in here that I like. I want to find jobs that have more of this, and then go through the whole skills as well. What are they requiring? What do I have? And what am I missing that I want to get? And what am I missing that I really don't actually care to get? So maybe this wouldn't be the job for me. I mean, you can actually learn a lot about yourself and what you want as you're going through these job postings. And then for the international experience, I just want to take a second and just also kind of highlight the fact that the experience is useful for the organization. They want you to have it for a reason. And it's also useful to you. So I like what Chi-Chi was saying, where volunteer, do internships, seek out experience in areas that you're passionate. This getting experience shouldn't just be something that will check a box for the organization. It should be something that will benefit you. So as much as possible, start trying to find that experience where you can in areas that you're excited about. So at the end of the day, you don't feel like you're wasting time. You're actually doing something that's fulfilling and getting you closer to where you want to be.
Hi, everyone. We're kind of at the end of our time, and I know we had a couple of questions, some about contact information. I'm happy to take any additional questions that you have. I will be emailing everybody who has participated today. I'll be sharing resources. I'll be sharing information about each of these mechanisms with you. This is just the brief contact information here. But I'll be sure to share that. If you have additional questions, feel free to reach out to me and I can make contact with our panelists. I know there was one specific question about pharmacy experience. I will do my best to find somebody who can give a really thorough answer to that question. But I thank all of you for joining today. Definitely want to thank our panelists.